Hello, I'm Dr. Jennifer Gutierrez, and I'm a clinical assistant professor in the Department of Otolaryngology at the Texas Tech University Health Sciences Center. I'm also a medical speech-language pathologist, and I'm the founder and executive director of The Storyteller and the World, a nonprofit organization that brings together physicians and therapists to provide evidence-based techniques and solutions all around the world, and to make sure that those solutions fit each healthcare model. Speaking of solution, I had the great opportunity to travel to Lucknow, India, to King George's Medical University in early 2020. A problem was brought to my attention and I was asked to help. They do not have a standardized or efficacious way to measure degree of nasality in patients with abnormal velopharyngeal closure or difficulty closing off the nasal airway during production of non-nasal sounds. Subsequently, they don't have a well-grounded method to recommend a prosthodontic speech aid appliance to correct the problem. We think we have a solution. We're going to use a multi-parametric approach, starting with an inexpensive piece of equipment that measures nasalence, and we'll take those values and combine them with other aerodynamic measures. We'll also take perceptions of speech by providers and the patients themselves. Where did we come up with this? Well, in 2007, Van Leerde et al. Conducted research, and the aim was to produce an effective, universal way to analyze resonance. Logistic regression revealed 4 key indicators of hypernasality. Number 1, nasalence values obtained during the sustained production of the vowel ah. Number 2, nasalence values obtained during the reading or repetition of 2 distinct passages, one with nasal sounds, one without nasal sounds. We are developing those in Hindi. Number 3, the maximum duration time recorded during production of the voiceless consonant S. And number 4, condensation recorded on a mirror held beneath the patient's nose during production of the sustained vowel ah. So those metrics were plugged into an algorithm that yielded a nasality severity index, or NSI score. For the purpose of their research, positive 14.9 was normal resonance, and negative 24 was slightly hypernasal. Bottom line, the more negative the number, the greater the association with perceptions of hypernasality. We appreciate these researchers' due diligence to find an effective, non-invasive, inexpensive way to analyze resonance. We want those outcomes too. And we also want to dig deeper into that qualitative component and really know how patients perceive their speech. To do that, we must use statistics. We're still brainstorming, but of course, we will collect descriptive, demographic, diagnostic, and nasalence data to produce normative and comparative results. We want to find out if somebody with cleft palate functions differently than someone with a cranial nerve issue. We might even get a little creative and use propensity score analysis to match groups and isolate things like age, sex, and diagnosis from the treatment effect, the treatment being the prosthodontic speech aid, and the outcome being the NSI score. We could use your help with this. We're innovative because commonly a scope is put through the nose to look at muscle function and then to determine if surgery is needed to correct the problem. This is not locally responsible nor reasonable. My local collaborators are ready to collect data and they are fully engaged. They are Dr. Saima Indra Singh, Dr. Aditi Verma, and Dr. Virendra Prasad, and they work in these units: the oral maxillofacial prosthetic unit, the prosthodontic department, and the plastic surgery department at KGMU. On my team, there's me, and there's also Dr. Yusuf Dundar, an ENT and otolaryngology surgeon, and Dr. Tobias Kroll, a speech-language pathologist and renowned qualitative researcher. If we win, we will use the money to purchase prosthodontic speech aid appliances for patients. They're not expensive, but KGMU is located in a resource-poor area. We are in the early stages of development. We seek further opportunity to speak with you, and we are grateful for any chance to partner with you on our dreams and goals. Thank you.